Hello, thank you for your interest in our abstract entitled Quality of Life Impact of Cutaneous Vasculitis, Findings from the VascSkin Study and the Vasculitis Patient-Powered Research Network. This is a collaborative effort of vasculitis care providers as well as patient partners. We understand intuitively that cutaneous manifestations of vasculitis have a quality of life impact. Skin lesions can cause itching, pain, ulceration, and certainly as a visible manifestation of disease, can have an important psychosocial impact. However, the quality of life effect of cutaneous vasculitis has never been studied in a systematic way. And so in this study, we administered two validated measures, one, a skin-directed measure, the Skindex 29, and the other, a general health measure, the SF36, to patients with cutaneous manifestations of vasculitis via the Vasculitis Patient-Powered Research Network. Now, overall, we had 234 responses after eliminating duplicates and limiting our analysis just to those patients who had experienced active skin vasculitis in the preceding 4 weeks. We had 107 responses to analyze. And what we found was that the quality of life impact of cutaneous manifestations of vasculitis was quite significant. For the Skindex 29, the skin-directed measure, we found that across all domains, emotions, symptoms, functioning, and overall or total score, the impact of skin vasculitis was considered severe or very severe. In the SF36, the overall general health, quality of life impact of cutaneous manifestations of vasculitis was considered below average in 6 of 8 domains. Now, looking at specific subgroups, we find that quality of life impact corresponds to disease severity, unsurprisingly. So more severe or active disease corresponds to greater impact and more diminished quality of life. The same is can be said for shorter disease duration. So patients who had been diagnosed with vasculitis more recently than 2 years prior to the survey also had a more significant quality of life impact. Our goal in this study was not necessarily to compare directly disease subtypes with one another, but we do see some interesting analyses here. In the skin-limited cutaneous small vessel vasculitis group, we see as great, if not a greater quality of life impact compared to other types of vasculitis where there are frequently systemic manifestations to be found. So again, underscoring the significant effect that cutaneous vasculitis can have on quality of life. Now, of course, there are additional analyses that we are interested in doing. We would like to understand in greater detail the role of cutaneous vasculitis in determining that overall health-related quality of life. We'd like to compare the impact on quality of life of cutaneous vasculitis to that of other skin conditions that have been studied systematically to compare that impact. Certainly we are interested in how the quality of life responds to treatment over time. And we hope these data may help form the basis of a patient-reported outcome tool for measuring disease severity in response to treatment in clinical studies. So in summary, we find that with administration of validated skin-specific and general health surveys to patients with cutaneous manifestations of vasculitis, that diminished quality of life is found across multiple domains, suggesting that skin vasculitis has a significant impact on health, well-being, patient symptoms, and self-perception of health. Thank you very much.